Om Swastiastu. Good morning. We are from SGD B2, the second semester of PSSKPD 2021. Today, we would like to present our final student project presentation, which title is Concomitantly Use of Conventional Medicine and Traditional Medicine and How to Appropriately Use Them. Before we start, I would like to show our members that will do this presentation. Here are our members. And now let me introduce myself. My name is David Christopher Tjandra. My last 3 digits of student number is 066. And now I would like to explain the introduction part of this student project. Next, the background. Nowadays, there are two types of drugs that are often consumed by patients. They are conventional medicine and traditional medicine. Conventional medicine is a treatment given by doctors, nurses, pharmacists, and therapists to treat a patient's symptoms and illness using evidence-based drugs, radiations, or even surgery. For example, using antibiotics and antivirus. Meanwhile, traditional medicine is knowledge, skills, and practice based on theories, beliefs, and experiences derived from different cultures, whether explained or not, used in the maintenance of health, as well as in the prevention, diagnosis, improvement, or even treatment. For example, jamu and kencur. Next, patients are usually prescribed conventional medicine by doctors. However, not a few of them took conventional medicine and traditional medicine at the same time. Many patients think that their concomitant consumption can increase the effectiveness of the treatment. What they don't know is that it can cause big problems that can lead to other serious medical issues. Thank you. Next.
Good morning. I'm Ledwin Wibisono. My last 3 digits of student number is 061. Today, I'm going to present about the problem formulations of our student project. So there are 3 problem formulations. The first one is, what are the advantages and disadvantages of conventional medicine and traditional medicine consumption? And the second one is, what is the difference between conventional medicine and traditional medicine? And the last one is, what are the risks and problems that may occur in the concomitant use of conventional medicine and traditional medicine? That's all from me. Thank you.
Good morning, my name is Komang Ayu Widhiani. My last 3 digits of student number is 044. And now let me continue the presentation with the objective of this student project. The first one is to describe the advantages and disadvantages of conventional medicine and traditional medicine consumption for determining their characteristics. The second one is to show the difference between conventional medicine and traditional medicine. And the last one is to elaborate the risks and problems that may occur in the concomitant use of conventional medicine and traditional medicine. That's all from me. Thank you.
Good morning, I'm Nevinne Nathania Susanto. My last 3 digits of student number is 051. Now I'm going to explain about the benefits of this paper next. First off, for the public community, first it is to introduce the public about the advantages and disadvantages of conventional and traditional medicine consumption. Next is to inform the public about the difference between conventional medicine and traditional medicine to avoid public confusion. Next it's to increase public knowledge about the risks and problems that occur in the concomitant use of conventional and traditional medicine. Second is the benefit for the institution. First, it is to add source of knowledge about the differences between conventional medicine and traditional medicine to avoid public confusion. Second, as a learning material to introduce students about the way to use conventional and traditional medicine properly. Lastly, it is as a base for further research on minimizing the problems and risks that occur in the concomitant use of conventional and traditional medicine. Lastly, the benefits for the academicians. Firstly, this paper can be used to expand medical students' knowledge about the problems based on concomitant use of conventional and traditional medicine. Secondly, it is to improve literacy skills and conducting research, especially in researching the ways to use conventional and traditional medicine properly. Lastly, students will increase their medical resources about the general concept of conventional medicine and traditional medicine. That is all from me. Thank you. Next.
Good morning, my name is Janice Wijaya. My last 2 digits of student number is 037. Now let me continue the presentation with the general concept of conventional medicine. So conventional medicine is a treatment by doctors, pharmacists, nurses, and therapists that can lead and treat various diseases that may be present in patients using drugs, radiation, or surgery. The invention and usage of conventional medicines continuously increase over the time. For example, antibiotics usage in low middle-income country rates increase due to infectious cases. Conventional medicine is mostly safe and effective because it has gone through the research processes. But but inappropriate intervention of antibiotics that are caused by the drugs regulations itself or the lack of knowledge from the physicians can lead to antimicrobial resistance. Some examples of conventional medicines are antibiotics, antifungal, and antiparasitic drugs. That's all for me. Thank you. Next.
Good morning. My name is Gusti Agung Saraswati. My last 3 digit of student number 056. Now I will explain about advantages and disadvantages of conventional medicine. Advantage: professional practice trainer, strict guidelines or regulation, quality control procedure, insurance based on scientific research. Disadvantages: synthetic drug and invasive procedure only cure symptoms, patient won't change lifestyle, side effect, and expensive. That's all for me. Thank you. Good morning, my name is Marta, Vitti, Lawi, and my last 3 digit of student number is 064. Now I'll talk about traditional medicine. According to World Health Organization, traditional medicine is knowledge, skills, and practice based on theories, beliefs, and experiences from different cultures that are used to maintain health. Traditional medicine has usually been known for centuries. Even some people believe in traditional medicine more than medical treatment. In Indonesia, people consume medical plants that are processed into herbal drinks or commonly known as jamu to prevent or treat disease. In China, traditional Chinese medicine uses a mixture of psychological or physical treatments consisting of herbal remedies and acupuncture. In India, Ayurvedic medicine has a balance of concepts of body, mind, and spirit through special diets, yoga, and meditation. And last, in traditional African medicine, physical availability such as smell, shape, color, and rituals such as mantras or songs are more important than pharmacological. That's all from me. Thank you.
Good morning, my name is Yovilia Tio Yunus and my last 3 digit of student number is 035. Now I will explain about advantages and disadvantages of traditional medicine. The advantages of traditional medicine when compared to modern medicine include relatively small side effects. One plant can cause more than one pharmacological effect. Traditional medicine is more suitable for metabolic and degenerative diseases, and existence of complementary or synergistic effects. The disadvantages of traditional medicine include weak pharmacological effects, raw material are not standardized, have not been clinically tested, and are easily contaminated by various types of microorganisms. That's all from me. Thank you.
Good morning. My name is Nyoman Putra. My last student number is 050. Today I will explain about the difference between the conventional medicine and traditional medicine. The difference, first, is accessibility. Traditional medicine is more financially accessible, and people who live far away from conventional healthcare institutions prefer traditional medicine because it's more physically accessible. Second is about the legality. Conventional medicine is generally more legal worldwide. And the other side, the legality of traditional medicine practices depends on its region or area. For example, in South Africa, China, and Russia. That's all from me. Thank you.
Good morning. My name is Christine and my last 3 digit of student number is 045. Next is the risk and problem of concomitantly use of conventional medicine and traditional medicine. The use of traditional and conventional medicine simultaneously can actually be done as long as it does not cause excessive side effects or contraindication occur. However, it is undeniable that there are several which can pose risk and also side effect to the user. Traditional medicines are natural products and can be misunderstood as safe. It can cause adverse effects such as allergic reaction, skin rashes, asthma, headache, dizziness, agitation, and dry mouth. Traditional medicine may also modify the effect of conventional medicine. For example, cranberries and ginkgo biloba have a high risk of bleeding and should be used with caution by those taking anticoagulants such as warfarin and aspirin. Thank you. Next.
Good morning, my name is Nyoman Ayu Widhiani with 3 last digit of study number is 070. Now I will explain about the proper use of conventional medicine and traditional medicine. Proper use of medicine is described as a group of criteria that ensure optimal risk or benefit and cost-efficacy ratio for a class of medicines on both an individual and societal level. The proper ways to use traditional medicine include proper identification of the medicinal plant in a traditional medicine. Check if there are any regulation or information about the traditional medicine that you will be using. Use a proper amount or dosage for the traditional medicine. Reconsider if it is really necessary to take the traditional medicine, and doing a consultation with a healthcare practitioner needs to be considered in order to anticipate any adverse effect of the traditional medicine. Stop if there are any harmful effects and report to the healthcare practitioner. That's all from me. Thank you.
Good morning, my name is Fernando Ghosali and my last 3 digits of student number is 036. So the summary is the concomitant use of conventional medicine and traditional medicine really happened. Concomitant use of conventional medicine and traditional medicine can be done as long as there are no excessive side effects and there are no contraindications. Things that need to be considered in the concomitant use of conventional and traditional medicines are the risks and the problems that can occur during the treatment process, the ingredients and number of doses are needed to avoid ADR. That's all from me. Thank you.
Good morning, I'm Amanda Devasya. My last 3 digits of student number is 068. Now I will continue the presentation. The use of conventional medicine and traditional medicine simultaneously is often done by the community and is not prohibited. But on the other hand, these activities can have an impact if there are side effects and contraindication. This research is also very valuable for us, the writers, in understanding more about the lecture material. This project gives us more understanding of what we can do to educate patients and the public about using conventional medicine and traditional medicine at the same time. Both conventional medicine and traditional medicine needs to be considered so that unwanted things don't happen. That's all from me. Thank you.
That's all for our student project presentation today from SGD B2. Thank you for listening and giving your attention. Lastly, I would like to close it with the Parama Santi. Om Santi 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 Om. Thank you. SGD B2, Jaya Jaya Jaya.